Hi, Dr. Landa here. First of all, I just want to say that this video is for educational purposes only and not intended to be considered as therapy. I'm going to be talking about my perspective on attachment theory. If you don't know what that is, I'll talk about that. I'll explain it briefly. The reason why I'm doing this video, I thought it would be helpful to clarify some misunderstandings I'm coming across with the recent years from the community, different people from different places, including from former patients that I've had, and thought it'd be a good idea to clarify some things. So first of all, attachment theory. What is it? So this theory started by an author by the name of Bowlby years ago. Put simply, and this is kind of a complicated topic, by the way, because it gets interesting. But I'll try my best to make it very simple. So this author years ago found that the way we experience bonds with as infants, as babies, with our caregivers, whomever it may be, tends to set a template, if you will, for your future or the future of the person. And that can lead to attachment theory has been associated with mental health problems like anxiety, depression, avoidance, and so on, right? Even what they call in the field personality problems. I quote this because I'm not really sure if, well, there's complexities to it, like I said. So my concern with this is that, and concern is a really strong word, but I get questioned this a lot about, like, oh, people looking this up online and diagnosing themselves because they took some questionnaire or they saw some of the features of some attachment style or attachment pattern, and they just jump to make the assumption that, oh, I have that, so therefore I'm anxiously attached, or I'm avoidant attached. And it's not that simple. Also, I took a look at YouTube videos and see what content there is there and articles from different websites, and I was kind of not disappointed, but they don't really go in depth into it. They go very surface level into it, and by going surface level, people get I think educated poorly on the matter because it's so surface level, and it leads to more concerns than answers, if you will. So what I typically tell people is that the message is only as good as the messenger it comes from, right? So in this case, the message being what I'm going to express and explain to you about my idea of it, my understanding and my work with it. I'm going to explain where I'm coming from with this. So first off, my dissertation was an attachment theory. The title of my dissertation was Attachment and Self-Compassion Among Mexican Americans. And I'll make another video explaining what I found with it and all that stuff. If you don't know what a dissertation is, it's basically a huge research project that you have to complete to get to earn a doctorate. That's basically it. There's different types of research studies, and they get published. Not as journal articles, which is a different thing. I'll make another video about that. But just it gets published, and there's different types of studies, from qualitative, which is more about words and narratives, and quantitative, which is numbers and how you analyze those numbers. And there's mixed too, which includes both. So mine was a quantitative study. I used some questionnaires that we called measures, and I used the scores that participants that I had from those measures to analyze the data and find. I did mine a bit complex. It was further than most studies tend to go sometimes. I was told that by some of the faculty that I reached out for help, including one that I didn't have to, but I was encouraged to. He's like the guru of statistics in the school, and he told me, like, oh, this was pretty comprehensive. I rarely see a study like this. I'm like, oh, thanks. Took it as a compliment. Like, okay, Why did I do it that far? Because I just wanted to find out um, uh, answers to my questions. And I'll talk about that in another study, in another video, sorry. Uh, and I was able to do my dissertation because of my professor, who unfortunately passed away a couple of years ago from her fight to cancer. She was the guru. Uh, I don't use this word, typically don't use the word expert, but she's, from my view, in my opinion, she's, and a lot of colleagues would agree with this if they knew her, she's as close of an expert as you can come to attachment theory and psychoanalysis and all this. Attachment theory is a bit of a branch from psychoanalysis, but it's been heavily researched in the scientific community. Not as well known as I think I would like or would benefit, but it's been heavily researched to an extent. So that's where my background comes from. My dissertation gave me a lot of knowledge. Also, my close classmates at the time, and some who continue to be close colleagues and friends and know more about this stuff than I do, and I sometimes seek them out. Not lately, because I haven't been needing the help lately, but that's where my knowledge comes from. So the best way I can describe it is in terms of attachment. It's not a yes or no type of thing. It's not a binary thing, like either I have it or I don't. It's complex. It's a continuum. Tends to be. So that's the thing I don't like from online questionnaires. They don't clarify this, or at least I haven't seen the clarification, that they just show you the score. You're like, oh, I'm anxiously attached. Like, no, hold on. It's not like that. There's a continuum. I'll put myself as an example. There's people who I would say I have a what is considered a secure attachment. That secure just means that you have comfort with them and are open with them and don't feel the need to reserve yourself with them. There's people who I feel I'm very open and honest with and have a very deep sharing of life with. What I mean by deep sharing, like I'll share my personal experiences and whatnot. No topic is off limits. Yeah, and there's other people who, yeah, I don't share anything with them. A good example would be total strangers. Does that mean I have an avoidant attachment with them? Not necessarily, but I don't really share anything with them, right? I would think that would be wise, right? Because we don't want to share everything with everybody that we meet, right? Because you don't know where people's intentions are, or what backgrounds they have, right? So what I learned from my professor, who was one of my mentors, was that is that we have different attachments with a lot of different people. I mean, we could even make the argument that you have different attachments with your loved ones, to your friends, to the public, to classmates, to professors, to your boss, to your significant other, to your pets even, to objects even, like a car, right? There's some people who love their cars, okay? Another question I could get is like, well, one patient a while ago asked me, hey, so I like to, my teen tends to love to isolate herself or self in the bedroom. Is that normal? Yeah, I mean, we all need privacy sometimes. Doesn't mean that we're avoidantly attached or anxiously attached, right? We all have a combination sometimes, or more one thing than the other. Can it become a problem? Yeah, that's when I would suggest, yeah, seek professional help. That's something you won't get from a website, right? Or a YouTube video or anything of the sort, even a published study. Seek help. But my thing is that, and my intent with this video is that, don't let a score from a measure that you found online or an article you found online freak you out or scare you in thinking like, oh man, I'm attached this way, I'm screwed for life. No, I'm gonna quote a presenter from a workshop I went to about psychology that talked about this. We were talking about that, and he said scoring a certain way in attachment is not a death sentence. We can always evolve and grow, right? which is a nice thing about not being static in human existence. We're meant to evolve, to grow, right? Some people have asked me also, hey, so will it take time for me to grow from this? And my answer is usually, yeah. I mean, I can't say if it's going to be an overnight thing or over several weeks, days, weeks, or months, but I'll give you an example of the best way I can explain it. So, and I've said this to several different types of patients that I've had in the past from different ages, right? So say like, for example, I don't know, you're 32, 30, or 29, 28, I don't know, whatever. And I'll tell you the following. So technically, you've been alive, say if you're 31 years old, okay, you've been alive consciously, your mind has been alive for like 31 years, okay. That means that you've had roughly, I don't know, 28, 29 years of training your mind through your experiences and your interactions with people around you. You shaped your mind to think and behave a certain way. Then it's going to take time to evolve those patterns. It's tough to change evolve us from our former habits overnight. And sometimes I tell people that's a good thing, because usually lasting, for a lack of a better word, change, you have a better shot with that when it takes time rather than it's an overnight thing. Because when it's an overnight thing, it didn't really give the mind time to process and digest it. So I'm not surprised when things like change overnight, and then after like a week or two, we're kind of back. I was like, yeah, but from my experience, tends to lasting change, if you will. It's you have better odds when it takes time to progress. Those have been my best cases. I also want to mention something about studies, because I've been asked by people too. Sometimes this comes up like, well, I saw this article that talked about how people with anxious attachment, tend to have anxiety, and the more insecure you are with with attachment, the more anxious you are. It's like, yeah, but it's not that sentence. I mean, there's also published studies that suggest, based on the findings, that I forgot where I saw this, but like for instance, there was this article that I was reading about how people who fit the diagnosis of borderline, which is a whole different video, they tend to improve in time, even without therapy. I don't remember if the study included therapy or not, but let's say worst case scenario, it didn't. That over time, they show less symptoms of that. And my thought for that is that my explanation for that is, okay, so the possibility is that with time we evolve how we think, and we tend to get tired of certain thinking processes that we have, thinking patterns, right? And we tend to find more peace when we shift from negative thinking to positive thinking. So that might be what happens too. I don't know. That's just my theory, right? I also mentioned this, like there's studies that have found that in time people stop taking anti-anxiety, and I think antidepressants also. They tend to titrate off. Titrate means that you take lower doses, and the theory behind it is that we evolve. We kind of grow out of the old thinking ways and negativity, and we switch to positivity. Is that always the case? Can't say that. I don't know, but that's a theory, right? I remember my first mentor from undergrad. Undergrad is college, for those who don't know. And I was in my last year, and I came up to ask the professor, who's my mentor, hey, so with so many studies being published, how do you know what to take? How do you know which one to believe and which one you don't? And her best advice was, which was great, I loved it, and she was saying, I would suggest taking any published study, regardless of the results, with no more than 70 to 80% certainty, because you never know, something else might come up, and it's like, okay, so that's how I take it in terms of attachment theory in any kind of studies. Like I don't take it for solid 100%. It's like the gold standard, like the ultimate truth. No, uh, human existence doesn't work that. We're complicated, and that's a good thing because it can help us. So I'm hoping this was helpful, and again, if you find that some symptoms that you relate with, okay, try not to get concerned for yourself about this, because we all have different attachment patterns with everybody. It's human nature. It tends to be healthy that way. Uh, you may have a secure attachment with someone and more of an anxious attachment to someone else because of whatever history or something happened, or an avoidant attachment with someone else, or even a disorganized attachment, which is also a thing. Uh, if you find these, feel free to consult with a professional, seek professional help, talk it out. And when it comes to mental health, I can tell you that some things are not set in stone. And I say that way because I can't speak for everything, but from my experience, and what I've learned from mentors is that there, if there's a way, you just have to go out and search for it, right? But that comes from seeking out with the professionals who have the experience to better help you, and they're not limited by what a website told you, or a measurement, or a book even told you. The problem with books, websites, and even videos like this one is that you're limited to the knowledge you're gaining because of the data they're giving you, right? So I'm doing my best right now to explain attachment, but it can get complex. There's topics of attachment that I haven't even touched on. So my intent with this is to hopefully calm whoever mind needs to be calmed. If you're interested in looking into attachment, and go do more research. One article is not going to cut it. It took me well over a year to understand this stuff better. It's not an easy concept, theory to understand. It can get complicated. Can you grasp it? Yes. Can it take time? Yeah. Will a week or a month do? Probably not. There's so many studies out there, so several books out there, and some books are thin, some books are, not kidding you, very thick. I'm not exaggerating with this length. I don't have the book with me, but it's the biggest one I have is on attachment theory. It has a lot of studies included in it. So again, I'll leave some links in the description below if you would like to seek out some therapy. Some are online services now. If you have certain insurance, you qualify. There's also 211 and the crisis line, which I'll leave below. If you have any questions or comments, feel free to leave them in the section below. I'm also going to share this. If you want to share this video, go for it. Don't feel like you have to ask me. I'm doing these to better help expand people's awareness of this, hopefully. So feel free to share it if you think it'll help someone else. Thanks for watching, listening, and as always, I wish you the best. Be calm, treat yourself well, and take care of yourself. Bye.